ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to ECDC On Air. I'm your host Nicholas, and today's topic is avian influenza. We've been talking about this in earlier episodes of this podcast, but today we have two guests with us, Angeliki Melidou and Katriina Willgert. Hello and welcome.
Thank you for the invitation to join you.
Thank you, Nicholas, for inviting us.
So you're both experts here at ECDC on avian influenza, and it would be interesting to hear a little bit more about the current situation in Europe. But first of all, we've heard a lot of media attention. There's a lot of talk about how avian influenza can become the next pandemic. Why do you think there is such a public health concern right at this moment?
Yeah, so in the past few years, we've seen widespread circulation of avian influenza virus type called AH5N1 in wild birds, both in Europe and globally as well. And this past autumn, we saw a surge in detections that was higher than has been previously recorded in wild birds. And this high circulation in wild animal populations also results in spillover to wild mammals, and as well as causing outbreaks in poultry.
And has this changed the risk to Europe at all?
So when it comes to the risk of human exposure with the widespread circulation in animal populations, there's an increased risk of individuals being exposed to infected animals. But so far we have not recorded any human cases of avian influenza AH5N1 in the European Union. There have, however, been sporadic cases detected and reported globally. And most of these have had known exposure either to infected poultry or contaminated environments. And more recently as well, there have been known the ability to spread from poultry to infected cattle in the United States.
We notice here that people are talking a lot more about avian flu and are more concerned about it. Why is it such a public health concern? This goes back a little bit to the basics that we have been talking about in other episodes here at ECDC On Air, but maybe you can just give us a little bit of a lowdown. Why is it such a public health concern?
So we know that for previous pandemics, they have involved influenza subtypes that at least partly have originated from animal populations. And that is one of the concerns, that a virus could potentially mix with other human influenza viruses and or influenza viruses from other animal species and create a new virus where there's no protection or immunity in the population available already. There's also a possibility of with continuous infections occurring in mammals or potential humans as well, that the virus could adapt and change over time and become more transmissible and obtain the ability to transmit between humans.
I've seen figures like between 15,000 and 75,000 people every year die of seasonal flu in Europe. So what's really the difference between avian flu and seasonal flu? Avian flu, we haven't had one case, or very few cases at least, in Europe. And with seasonal flu, we have so many cases every year. What's your comment on that in terms of the impact?
So one of the main concerns with these zoonotic influenzas, so influenzas that can transmit from animals to humans, is that if they were to gain the ability to transmit between humans, that there would not be the protection available already in the population. We do know from the zoonotic influenza viruses that we've seen globally that even if in recent years there have been many mild cases of human avian influenza observed, infections can also be very severe with in certain countries mortality approaching 50% among those cases that have been reported in humans.
So in terms of the potential for it to spread right now, is it still at the stage where it doesn't actually affect humans in the sense that it transmits between humans?
Yeah, so there has not been no sustained human-to-human transmission for avian influenza viruses AH5N1. It still remains avian-like, which means it has a preference for receptors that are present in birds rather than human receptors. But one of the potential concerns could be if it would change in future and be more adapted for human transmission.
And I want to fill in as well to say that the risk level may change then for infections to humans if the virus becomes adapted to humans, because now the risk of infection for the general public is low, and for those that are routinely exposed to infected animals or contaminated environments, it's low to moderate. But if the virus acquires the ability to spread more easily from animals to humans, or from human to human even more, then the risk level will change.
In December last year, ECDC released a new guide for EU member states, giving them like a framework for like preparing for and responding to influenza transmission from animals to humans. So you were very much involved in producing that document, Angeliki. I'd like to ask you a couple of questions about it. Can you tell us first just about the scope and the purpose of this guide? Why did we decide to release this at this point?
It's two parts on your questions. Why do we release it now, and what's the aim of it? So maybe I can start with the aims and the targets. It's, as you said, we wanted to provide a common framework for the European countries to support them with preparing and responding to these zoonotic threats that Katriina just now described. That was our aim, to provide a very practical tool for the countries that they can use when they prepare for zoonotic threats. They are currently, European countries, updating their pandemic preparedness plans, and they can use this tool. And it also provides a common language for European countries to describe the situation when there are cases in Europe and assess the situation. It complements kind of their risk assessment. And it provides also a list of public health actions that they can then decide upon after the risk assessment which ones to follow. But it's a really practical tool for this. And why now? I think that Katriina explained it very well, but it's the right point to get prepared because there is this unprecedented circulation of avian influenza in Europe. We have been seeing avian influenza circulating in animals in Europe for the past 5 years, so we need to prepare for human cases in the European Union countries as well.
So let's look a little bit more at the scenarios that are presented here in this guide. So you go through various scenarios of what could be happening. Tell us and explain a little bit more how you looked at these scenarios and what they are.
Yeah, so there are 14 predefined scenarios, predefined, let's say, situations, and then further categorized based on whether there are mammalian adaptation mutations or not. And the scenarios look at the epidemiological and the virological characteristics when there is a human case. So we will know, for example, how many human cases, if it's an isolated case or a cluster of human cases, many, 2 or more in the same area, in the same time period. Then we will know if there's exposure to infected animals, birds or mammals. And we will know the severity, if it's a severe human case or not. And if there are mammalian adaptation mutations or not. Of course, some of these may be unknown still at the early phases of the investigation, but we take a precautionary approach in each. And then taking into account all these epidemiological and virological signals, the scenarios are defined and scored, and then we extract the relevant public health measures for each one.
Do you at all discuss the likelihood of any of these scenarios happening?
No, that's not the purpose of this document or this framework, to predict how likely it is for one scenario to happen over another. However, in the scoring, we do take into consideration, for example, that by scoring it higher, that when there is a mammal exposure to a mammal, then there is a higher chance that there will be mammalian adaptation mutation. So this scores a little bit higher than if it's a bird that is linked with the human case. So the scoring takes this into account, but it's not the scope of this framework to provide this likelihood of whether there will be a pandemic or not.
And then in each scenario, then there is a set of recommendations for public health authorities that they should be adapting then, depending on the characteristics of the scenario.
Exactly. Then and there is an automated tool also that that countries can use that defines the scenario based on the epidemiological and virological characteristics that you enter, and extracts the relevant public health actions that we suggest. And it's basically a flexible tool that the countries can use to base their national decision making. So we are suggesting which public health measures we consider are more appropriate in each scenario.
Do any of these scenarios cover the possibility of a widespread pandemic?
No, this is a pre-pandemic scenario framework. So we do not cover the possibility of sustained human-to-human transmission. The last scenario that we describe is the one that there are clusters of human cases with no known exposure to animals or with known exposure to humans, other human cases that are severe and that are that have mammalian adaptation mutations. But where we stop. It's the limited human-to-human transmission before the pandemic, the widespread, full-blown pandemic occurs.
Yeah, and the reason is it because you need a whole set of different. When we move into pandemic situation, is it that is so different that the measures that you have in a pre-pandemic scenario would not be applicable in a pandemic scenario? Is that correct?
Yes, I think that we are talking about prevention now. So if we are in a pandemic situation, that's a completely different situation. We need to activate the pandemic preparedness plans, preparedness and response plans, and we are into a different situation when you cannot stop a pandemic anymore. It's already happening. So we focus now in this document in the pre-pandemic situation that we are currently into, or inter-pandemic situation between pandemics, because we do know that there will be another one from influenza at some point in the future.
I'd like to take a bit more of a look at the tools available. So in the scenarios, you list actions and tools that can be deployed. Just so we can get a better idea of what these tools are, can you give us some examples?
So when we say tools, we can discuss the toolkit of public health measures that we describe in the document. For example, occupational health and safety related measures like organizational, technical, personal protective measures that need to be deployed to
These
protect.
are mainly people that are working directly with birds, like in farms.
Exactly.
Yeah.
Yes, that they need to be protected to minimize also exposure. Then we have the risk communication that to the general public, to the healthcare workers, to the farmers, and targeted communication activities. And then we have, of course, surveillance and targeted testing, laboratory preparedness, research activities, and of course, some medical countermeasures, antivirals, and vaccines. We have also worked, and Katriina has led this very important document together with EFSA on how to work together in a One Health approach with the animal sector and the environmental sector on investigating outbreaks and managing outbreaks in animals and potentially human cases. So this is also something we link very much with this pre-pandemic scenario document.
So if I understand correctly, it's like a staged kind of deployment that, in the early, maybe the less dramatic scenarios, you will have certain tools, and then as things maybe escalate, then you will have the more heavy ammunition, so to speak, to put into place.
Exactly.
Maybe Katriina, could you tell us a little bit more when we're right now in what is the baseline scenario and what actions are relevant to take right at this point?
So when it comes to any zoonotic infection, it starts with prevention at the animal levels. So at a farm, first of all, biosecurity and biosafety measures to reduce the risk of human exposure to infections that can transmit between animals and humans, as well as having preventive measures in place, such as personal protective measures that are adapted to the working environment where farmers are working. It also comes down to communication, so raising awareness of how individuals can reduce the risk of exposure and infection. And this includes both the general public, so avoiding contact with sick or dead birds. And this is both the general public and those that have, for example, backyard poultry. And if they would find dead birds, to contact the relevant authorities or their own veterinarian for safe collection and further investigation if this is considered needed, depending on the circumstances. At the farm level, it's about being aware of the risk of infection and how it can be reduced. And if you have exposure to infected animals, to monitor for symptoms of infection for 10 to 14 days, and contacting the relevant authorities again for follow-up and testing if you would develop symptoms. If an individual does not develop any symptoms but have had exposure that could be considered high risk, then testing could also be considered for these individuals on a case-by-case basis. And it's also about communication to healthcare workers about the epidemiological situation in animals. So if there is avian influenza circulating in wild animal populations or in domestic animals in an area, so that they are aware that there could be individuals that have exposure to infected animals, and that they are aware also of the potential symptoms they could present with, which can have quite a broad range sometimes. And also, if they have symptoms that are compatible with zoonotic avian influenza, that they inquire about potential exposure to animals in those cases. There have also been detections of avian influenza viruses in wild birds that do not show clinical signs of illness. So it's also important, for example, hunters that might be in contact with these apparently healthy birds that are infected, take precautionary measures when handling wild birds. At this stage as well, it's very important with this One Health approach, so establishing collaboration across sectors, animal health sector, human health sector, and environment sectors, to have those established channels of communication and information sharing, so that if there would be human cases or the situation evolves, that those are already in place and action can be taken in a timely manner.
If we start seeing human infections in Europe, what would be the first thing that we need to do?
They should be isolated depending on the severity. It might be isolation at home, or it might be in a hospital. It might depend on the circumstances as well. So that there it would be to follow the national guidelines and procedures for this. And it's also very important to follow up with contact tracing, to identifying any contacts of an affected case and that they are tested. So any additional cases are identified as soon as possible, and preventive measure for onward transmission can be put in place to reduce the risk of additional cases.
And if we do see additional cases, like we see humans infecting other humans, are we there? We're halfway down the line to the next pandemic then?
It has happened before. We had clusters of limited human-to-human transmission in households and in healthcare settings, but it didn't evolve to a pandemic, so it can happen. But it's critical that at this stage we contain the outbreak and we do what we can to stop it there.
What should public health authorities be thinking about in terms of public communication, so that people don't underreact or don't overreact?
I think we need to be clear that the risk of a pandemic is not higher at the moment, in terms of there is no indication that the pandemic is closer. But we need to make people understand that influenza is unpredictable and it can happen. In terms of the current epidemiological situation, I think it's important that the general public is aware of the epidemiological situation when there are outbreaks in the area. So in their area, so they need to be aware so that they can protect themselves.
So you mentioned vaccines. Can you tell us a little bit more? Are there effective vaccines now against avian influenza?
So thankfully, we do have a vaccine, an approved vaccine in Europe for avian influenza. It's 5 as a pre-pandemic vaccine. And it can be used not for the general public, but for those that are occupationally exposed to infected animals. It can be used, it can be considered as a complementary measure together with the other measures that we discussed, like, for example, organizational, technical, and personal protective equipment, and biosafety and biosecurity in farms. And we have the seasonal influenza vaccine that is against the seasonal influenza strains that are circulating every winter. We do not expect that this vaccine will provide sufficient protection against avian influenza strains, but we do recommend that it is used in occupational settings to basically reduce risk of reassortment to occur. That is mixing of seasonal influenza virus strain with avian influenza virus strain or other animal virus strains and causing a new pandemic strain potentially. So with using the seasonal influenza vaccine, you reduce this opportunity of the virus to reassort.
And what about antivirals? I understand that's quite an effective way of treating somebody who's got seasonal flu. Does it work also for avian flu?
Indeed, we have the influenza antiviral drugs, oseltamivir, zanamivir, baloxavir, that we can use also for avian influenza infections to treat those patients. Of course, resistance can occur, and we need to monitor this very closely because the virus can adapt, and then the antivirals may not be effective anymore. But in general, we can use these antivirals for treatment, and we can use them also for prophylaxis, as pre-exposure prophylaxis before you get exposed, if there are cases in Europe in extraordinary circumstances, but we can also use them as post-exposure prophylaxis after you get exposure. For example, if you are a farmer that you get involved in cooling of animals that you know they have been infected, maybe you're eligible for post-exposure prophylaxis with these antivirals.
So before we close, I'd like to take just a bit of a wider look at what ECDC is doing in terms of avian flu. So we talked a lot now about the scenarios document. Can you tell us a little bit more about ECDC's role?
Of course. So we are monitoring situation globally very closely, looking at cases that are being reported in the world and where the information is available, also the viruses in affected cases, to see if there are any changes to suggest that their current adaptation to bird populations would be changing. So if there are any indication of mutations that would increase the risk to humans or make the medications we have available for treatment less effective, or if they would have a change in the match to available vaccines in case they would be needed in the future. We also work very closely with our partners, so for example, the European Food Safety Authority, and based on the information that they provide on the animal health side, combined with what we're seeing internationally, looking at if there's any need to changing our assessment of the risk to the human population in Europe. We also work to try to support member states in being prepared in case there would be any changes to the current situation, for example, through this framework that we have just described, so that there are tools available and ready to be implemented.
I think you mentioned as well that there is quarterly avian influenza monitoring reports. That's done together with the European Food Safety Authority, right?
We publish avian influenza monitoring report on a quarterly basis together with the European Food Safety Authority, as well as the EU Reference Laboratory for Avian Influenza, where we bring together the information available on the current epidemiological situation, both in Europe and globally, from an animal health side, from a genetic characteristics of the viruses that are circulating side, as well as the human health side. And then they will also provide recommendations for response and a risk assessment of the current situation in Europe for the general public.
This is also supporting the countries with updating their pandemic preparedness plans that they are mandated to do now. And they're working we're working very closely with the countries on this and identifying the gaps that we can support them with. And actually, we are planning to work closely with the countries on the implementation of this pandemic preparedness scenario framework to see how we can support with actually implementing this and operationalizing this in the coming months.
That's all the questions that I have for you today. So thanks a lot for being here. It was really interesting to hear your perspectives on avian flu.
Thank you for having us, Niklas.
Yeah, thank you so much.
We hope you enjoyed watching this episode of ECDC On Air. Check out our website or our social media for more information. And if you like this episode, please give us a review.